Canine Parvovirus, commonly known as Parvo, is a highly contagious viral disease that primarily affects dogs. The virus is transmitted through direct contact with infected dogs or indirect contact with contaminated objects such as food bowls, leashes, and the environment. The virus can survive in the environment for months and is resistant to many common disinfectants, making it particularly challenging to control. Once ingested, the virus targets rapidly dividing cells, particularly in the gastrointestinal tract, bone marrow, and lymphoid tissues. The primary site of replication is the crypt cells of the intestinal lining, leading to cell death and sloughing of the intestinal epithelium. This results in severe gastrointestinal symptoms and secondary bacterial infections. The clinical signs of Parvo can vary in severity, but typically include lethargy, anorexia, vomiting, severe diarrhea, abdominal pain, and fever. Diagnosis is usually based on clinical signs and confirmed through laboratory tests. ELISA test, a common, rapid in-clinic test that detects the presence of CPV antigens in feces. TCR, polymerase chain reaction tests, can detect viral DNA and are highly sensitive. There is no specific antiviral treatment for CPV, so therapy focuses on supportive care. Fluid therapy, essential to correct dehydration and electrolyte imbalances. Antiemetics, medications to control vomiting. Antibiotics, used to prevent or treat secondary bacterial infections due to intestinal damage. Nutritional support, ensuring the dog receives adequate nutrition, often through a feeding tube if necessary. Pain management, to alleviate abdominal discomfort. The prognosis for Parvo depends on several factors, including the age and immune status of the dog, the severity of the disease, and how quickly treatment is initiated. Puppies and unvaccinated dogs are at higher risk and generally have a poorer prognosis. With prompt and aggressive treatment, survival rates can exceed 70%. Prevention is primarily through vaccination and proper hygiene. CPV vaccination is highly effective and is part of the core vaccine series for puppies and dogs. Puppies typically receive a series of vaccinations starting at 6 to 8 weeks of age, with boosters every 3 to 4 weeks until they are 16 to 20 weeks old, followed by annual or triennial boosters. Regular cleaning and disinfecting of the environment, especially in places where puppies and dogs congregate, is crucial. Effective disinfectants include bleach solutions and other virucidal agents. Infected dogs should be isolated from healthy dogs to prevent the spread of the virus.